Measuring blood pressure. Measuring vital signs belongs to the clinical daily routine. They provide important information about a patient's physical and physiological status. In addition to measuring respiration rate, pulse rate, and body temperature, it is essential that blood pressure is controlled. Blood pressure is measured on the patient's bare upper arm after a 3 to 5 minute period of rest. To begin, palpate the brachial artery between the biceps and triceps. Place the deflated blood pressure cuff about 1 inch above the cubital fossa, with the arterial arrow pointing distally. The measurement should take place with the cuff at the same level as the heart. The patient's arm should now be relaxed and slightly bent. Then palpate the radial pulse on the distal forearm and quickly pump up the blood pressure cuff. Once the pulse wave is absent, pump the cuff another 30 millimeters of mercury so that the cuff pressure is greater than the systolic pressure. Now place the stethoscope diaphragm lightly on the medial cubital fossa to auscultate the brachial artery. No sound should be audible at this point, since the increased cuff pressure has completely blocked distal blood flow in the artery during both systole and diastole. Carefully open the valve on the cuff so the pressure is released at a rate of roughly 2 to 3 millimeters of mercury per second. Because arterial compression still exists during diastole at this point, blood turbulently flows and consequently produces a so-called Korotkov sound. When these pulse-synchronous beating noises are audible, the systolic pressure can be read from the manometer. While pressure from the cuff is further released, the artery becomes less compressed. As a consequence, the intensity of the turbulent blood flow decreases until it is fully open during diastole. Now, a non-audible laminar flow replaces the Korotkov sounds. At this point, the diastolic pressure can be measured from the manometer of the blood pressure monitor. Afterwards, open the valve completely to let all the pressure out and remove the cuff. Measuring blood pressure can also be done while the patient is lying down. The upper arm should again be at the same level as the heart and the elbow slightly bent. Additional steps are the same as the directions described for measuring blood pressure while sitting. Measure the blood pressure for each arm to assess for potential differences, which would indicate an arterial stenosis due to, for example, peripheral arterial disease. If arterial hypertension is suspected, abnormal values must be measured at least 3 times on 2 separate days, and possibly further evaluated with self-measurement or a 24-hour ambulatory blood pressure monitoring.